Good evening everyone and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as Nurse with the Difference, and I make learning easy and accessible for students. Today we are going to be talking about infertility. When a couple gets married, there's this joy that comes when they give birth to children, and most times when this particular natural task is not achieved, sadness comes in. There's this feeling of incompleteness in the marriage. So today we're going to be talking about infertility. What is infertility? What are the various types of infertility? What are the causes of infertility, both in the part of the male and also in the part of the female? And how do we diagnose this infertility and the intervention we have to carry out in regards to infertility? By the end of this class, you will be able to understand all this correctly. But before we go into details, if you are new on our YouTube channel, kindly click on the subscribe button, turn on the notification button so you don't miss out. Let's go there. Alright, welcome back. Like I earlier said, today we are going to be talking about what? We're going to be talking about infertility. What is the meaning of infertility? But before we go into infertility proper, what is fertility? When we say someone is fertile, it simply means that person is able to give birth, is able to reproduce, is able to bring life into existence. That is what we mean by fertility. Then the other way around, when somebody is infertile, it simply means that this person is unable to reproduce and this person is unable to give birth. So from our textbook terms, infertility is the inability to get pregnant after 1 year of frequent unprotected sex. After what? After 1 year of frequent unprotected sex. So when an individual is unable to give birth after 1 year of unprotected sex, we can say those couples, something is wrong. There's infertility issues somewhere. So you can't just say somebody is infertile for just 2 months. You can't say someone is infertile for 6 months. But rather, infertility is what? Infertility is the inability of couples to get pregnant after 1 year of unprotected sex. That takes us to the various types of infertility. We have 2 types of infertility, which is the primary infertility and the secondary infertility. What is the difference between the primary infertility and the secondary infertility? In primary infertility, there is no history of conception at all. This individual has not conceived before. This individual has not fertilized an egg before. This individual has not reproduced before. So that is primary infertility. But in secondary infertility, this individual has history of, she has been pregnant before, he has fertilized an egg before, but now for the past 2 years, for the past 1 year, he or she is unable to reproduce. Do you understand? The primary, there's no history of fertility at all. There's no history of pregnancy or conception at all. But in the secondary, there is a history of conception and there is a history of pregnancy. But now, this individual is having difficulty reproducing. So, when an individual comes into the hospital facility as a nurse complaining of these scenarios of infertility, what you have to do is to assess this patient proper. As a nurse, before you take into consideration anything, assessment is of paramount importance. So you have to find out if it is a primary infertility or a secondary infertility. You also have to find out this person's nutritional intake. You have to find out this person's job to know, is it a job that is causing this infertility problem? You have to carry out history taking. You have to carry out physical examination to really find 1 or 2 reasons to get 1 or 2 information in regards to that infertility. Then that takes us to the causes of infertility proper. Whenever we hear the causes of infertility in our local community, the whole blame is pushed on the woman. Everybody blames the woman for not able to conceive, neglecting the male and neglecting the husband at that particular moment. So this class, we're going to be giving you the causes of infertility on both the male aspect and also the female aspect. On the male aspect, the first one we have here is inadequate sperm count. I know most of us are familiar with this low sperm count, right? Yes. So when we talk about when we talk about sperm count, we simply mean the amount of sperm, the amount of fluid that is being ejaculated into a woman during sexual intercourse. So how many sperm is this sperm plenty enough that is being ejaculated into the woman during sexual intercourse? And when this man is having a low sperm count, it can result in what? Infertility. In terms of sperm count, on the average, 50% of the sperm a man produce should be motile. They should be moving. They should not be static, but rather they should be moving. They know where they are going to where fertilization will take place. And also, at least 30% of what a man produces, the sperm a man produces, should be of the right shape. They should be quality sperm, not immature sperm. Take note of that. And also, what tends to reduce the sperm count of a man? The work he does, the work he carries out. For a man that drives big lorries, for a man that is always exposed to radiation, things like that, that creates heat to the scrotum and all those reproductive organs, it can actually result in low sperm count. And also, another thing that affects the sperm produced is actually what is known as cryptocitizen. What is cryptocitizen? Cryptocitizen is when the testes of the male growing up, when a man is growing up in the womb, the testes are in the abdomen. But when the man comes out, the testes has to descend into the scrotum of a man. So when there is failure of these testes to descend into the scrotum, it can lead to low sperm production. It can lead to sperm that has low sperm count, and there will be not enough sperm to actually fertilize a woman's egg. So all these are the likely cause or things that are likely going to hinder the sperm count of a man. Then another cause of infertility in a male is impaired sperm mobility. As name implied, impaired sperm mobility. That the movement of the sperm is being impaired. The sperm is unable to move freely. So the movement is being, when somebody's movement is impaired, that person will not be able to achieve that particular goal again. That is what is happening to the sperm. The sperm is unable to move. And what is going to cause the sperm not to move? For example, an individual having the prostate infection. There's an infection of the prostate gland. During that process of infection, the fluid that has been released, they are going to affect the motility of the sperm, and the sperm will not be able to move freely. So an infection of the prostate gland can result in what? Impaired sperm mobility. Remember, the prostate gland is found only where? In the male. It is not found in the female. Then the other cause of infertility is obstruction. As the name implies, something is obstructing a flow, right? If I'm going and something obstructs me, will I not stop? Yes. So obstruction of the sperm, obstruction of the flow of sperm out of the male can result in what? Infertility. And things that are likely going to cause this obstruction is epididymitis. Epididymitis, which is the inflammation of the epididymis. Please, I'm not going to pronounce it, so you can check the spelling below. So when there's an inflammation of the epididymis, it can obstruct the flow of the sperm out for fertility to take place. Then another cause of infertility is ejaculation problem. Do you know psychological stress? Like a man is depressed, a man is having a lot to think about, can actually affect ejaculation, can actually affect the fertility rate of a man. So ejaculation problem as a result of psychological stress can result in infertility. So at that moment, it is advisable we treat what is causing that psychological stress to enable the man become fertile. Then in terms of the women now, what causes infertility? The first one we have is ovulation. When egg starts before any other thing, just know it doesn't exist. So ovulation simply means the woman is not ovulating. There is no egg. The woman is not seeing his or her mess. The woman is not ovulating at all. Some women are born that way. That's what you should know. Congenital abnormality, Turner syndrome. So when they are born without no ovaries, you don't expect them to be fertile. So it should not, it's not shocking. You should not expect them to be fertile because they don't have the ovary that are to produce that particular egg for fertilization. So that can result in what? That can result in infertility. in the female part. And also hypothyroidism, the body is there's hormonal imbalance, can result in infertility of a woman. So that also results in all those that we talked about. Then another is tuber transport problem. You know, in a woman there are two fallopian tubes, right? So when there's an issue with the fallopian tubes, it can result in what? Infertility. For example, there's an inflammation, a swelling, an infection of the fallopian tube, which is known as sapingitis. It can result to infertility if not treated on time. You've heard of pelvic inflammatory disease as a result of recurrent infection in women. So when a woman is recurrently having infection, there's infection of the urinary tract, infection, it can lead to PID, which is pelvic inflammatory disease. And those things can actually lead to scarring of the fallopian tube. For example, there's a scar here. You know, scars are big, and the egg is supposed to pass through. The egg will not be able to pass because that scar might be obstructing the flow of that whole process. So when there's what? Tuber transport problem, it can lead to what? Infertility. Then the other one I have here is uterine problem. As the name implies, uterine, that's what I'm talking about, the uterus. There's problem with the uterus. And what are the problems of the uterus that can result to infertility? For example, the uterus, now there's a tumor, there's fibroid in the uterus. It can lead to infertility. The woman will not be able to conceive properly. The woman will not be able to give birth. And also when there's endometriosis. What is endometriosis? Endometriosis is when uterine tissue start developing outside the uterus. Things like that can result in infertility. And also when the body has decrease in estrogen and progesterone production. So when there's decrease in estrogen, there's decrease in progesterone production. The endometrium will not be formed to receive the zygotes, will not be formed to receive those zygotes that has to implant. So decrease in estrogen and progesterone can result in malformation of the endometrium during that period. Then we have vaginal problem, the vagina problem. So how does the vagina going to cause infertility? When there's an infection of the vagina, the pH of the vagina increases. And when a man ejaculates into the woman, that high pH around that vagina can kill the sperm. So when that kills the sperm, fertility will not be able to take place. The woman, fertility will be impossible, and definitely conception and pregnancy will be impaired or will not be possible. So those are the likely causes of what? Infertility. We said that we have what? Inadequate sperm count, impaired sperm mobility, obstruction, ejaculation problem, ovulation, tuber transport problem, uterine problem, and vaginal problem. That takes us to the diagnosis of infertility. When we talk about diagnosis, we simply need those tests that are carried out to really find out the problem. What is wrong somewhere? That's what we mean by diagnosis. So the first one we have is semen analysis. This is where the man's sperm is being analyzed to know, oh, how far, what is going through. So what happens is that 2 to 4 days before this man undergoes this test, there will be no sexual intercourse. So the man will masturbate. Masturbation will take place for this particular man to masturbate, then release into maybe a clean glass for the analysis. So when the sperm is analyzed, they check, oh, is it producing a lot? Is it not producing a lot? Because for each ejaculation or for each seminal fluid injected, we are supposed to be having 2 million sperm in each seminal fluid, that's in each milliliter of seminal fluid. So when there's reduction in this, when there's problem with the amount, it can actually result to infertility, and that will give them a clue on what to solve or what not to do. Then the other we have is sperm penetration assay. As the name implies, sperm penetration. We are trying to assess, oh, when a man ejaculates, does this sperm has the ability to go straight to the ampulla of the fallopian tube to be fertilized or not? So that is what this test is all about. It's checking the motility, it's checking the ability of the sperm to get to the target destination to carry out that function. But in such a case where it does not, so we can use this insemination to intrauterine insemination to actually help put the sperm there and help fertilization take place. Thank God for technology. Then we have ovulation monitoring. Ovulation monitoring is simply the cheapest method of actually checking fertility for woman, because what the woman has to do is to be checking the body basal temperature daily. The woman checks the body temperature daily, every day, continuously checking it, so you'll be able to why is during that period where the temperature is high, during the ovulation period the temperature is high, you'll be able to find out, okay, what and what is wrong, and what will be done to carry out that to sort out the problem. Then the other is tubal patency. Tubal patency has to do with the examination of the full of the reproductive system generally. Let's just take it in general, where the fallopian tube is being examined to check out, oh, is it okay, is it not okay, what is happening or what is not happening. So in terms of, you can use an x-ray to actually check the woman's womb and assess the abdominal and assess the reproductive organ to know if all the necessary things are present and what is happening and what is not happening. So you just check generally. So you can actually check for more diagnosis and drop on the comment section. I'll be willing to learn from you. Then the other we are going to be talking about is the intervention. We are going to be treating the intervention briefly. So the first one is correction of the underlying problem. For you to solve a problem, you have to know what is causing it. So the first thing is to solve, that is to remove the causative organism, is to remove the causative organism, or is to remove what is actually causing that particular thing. Now you find out the problem. Oh, it could be as a result of anovulation, it could be as a result of prostate infection, it could be as a result of this, it could be as a result of low sperm count. When you finally find out what is causing this infertility, the next thing is to correct the underlying problem, is to tackle the underlying problem. Then we have a reduction of the presence of infection. Like we earlier said, if it's infection that is likely going to be causing it, you have to treat this infection thoroughly by giving the prescribed antibiotics or by giving the prescribed medication to ensure that this infection does not take drastic effect. Then the other one we have is hormone therapy. Hormone therapy, especially for the women, we give them the gonadotropin releasing hormone. We go a long way to help release the necessary hormone necessary for the body to be prepared for fertilization and also development of a child, conception and pregnancy. Then we also have surgery. Surgery can also help to correct infertility, especially in a case where there is fibroid, which is myoma. So myomectomy can be done, which is the removal of the fibroid, to ensure that, okay, the baby has a place to reside or the baby has a place to dwell in. So a surgery can be taking place. Then therapeutic insemination. Therapeutic insemination involves inserting or putting the sperm directly in the woman's womb, so that fertilization can take place. So you are taking the sperm, putting it in the woman's womb, or your fertilization take place. Children, we need you. Children, start coming. So that is what therapeutic insemination. Then the last one we have is in vitro fertilization. In vitro fertilization is on the high side. People that have low sperm counts, people that have that are finding difficult with eggs and transport of the eggs into the appropriate place, which is the ampulla of the fallopian tube for fertilization, people having issues with that can actually go for in vitro fertilization, where the sperm is brought out, the egg is brought out, fertilization takes place outside the human body, but the rest stage can continue in the human body. So I hope this particular class on infertility help you understand. Don't forget, there are two types of infertility. We have the primary infertility and the secondary infertility. When it comes to the causes of infertility, we have those relating to the male and those relating to the female. Same also with the diagnosis and same also with the intervention. I believe we'll be having some more class about the intervention of infertility proper in our next video, in our upcoming videos. Thank you very much for watching our video. Thank you very much for staying tuned. Don't forget to like, don't forget to subscribe if you have not done so, and don't forget to click on the notification button so you don't miss out. For those that have not registered for our classes on Telegram, you have been missing a lot. Kindly send a message to the WhatsApp number showing in your screen to register for our Telegram class. Thank you. See you in our next video. Bye.